I'm Bob Schrupp, physical therapist.
I'm Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Yeah, in our opinion.
Okay, obviously this is not Bob. Bob's behind the camera, but Lonnie's going to help us out. She's normally doing the camera duties. Deep tendon reflexes. These are the tests that when you go to the doctor or a therapist, they pull out their little hammer and they start tapping on you,
Right.
and things happen.
Right.
So I'm going to explain a little bit why they're doing it, and you can do this to yourself at home as well.
Sure.
Okay? One thing you're going to need is a little hammer.
Not like that.
Not like this. This is not
You'll do some
work.
damage.
Oh my gosh, excuse me. If you don't have a little hammer like this, you can use your fingers and my hand, just kind of like a little karate chop.
Yeah.
But I'm going to demonstrate it first with the hammer. Okay, there's 3 of them that I'm going to go through, and this is working the neurological, they're called neurological tests, and we're going to start out with the knee. Okay, if you look at the kneecap, if you can kind of feel the kneecap right here, Lonnie's not ticklish at all, and you get to the bottom of the kneecap, and there's a tendon right here, and you're going to tap right there and see what happens. Can you see that, Bob?
Yep, absolutely.
If you look at Lonnie's foot and I tap that tendon, she's got a nice beat right there. Okay? Now that one, we would call that positive. Okay? It's working. Now what we're looking for, and this is something that you're not going to grade at home, you need to be a professional, is the grade of reflex. If someone kicks way out to here, then it's too positive, and there's a measurement for that. I'm not going to get into that. We're just getting into what we're looking for on that knee-jerk reflex, okay?
And if there's no reflex at all, it might not mean anything, but if there's no reflex there and there's reflexes other places, it might mean like if you're having a sciatic nerve problem, that it's actually the nerve was affected from your back.
It's being impinged or something that's not working properly. There's some other tricks to this, but Lonnie's got a good one going right here. A lot of times, go ahead, Lonnie, grab your hands like this, look straight ahead and pull as hard as you want. Let's see if we get a different reflex here. And it's just about the same. Some people have to do this in order for it to work. I don't want to get involved with the reasoning for that. We're going to go to the next one. Same thing, you take your reflex hammer, and right on the tendon, the Achilles tendon right here, I'm just going to tap that, and you're going to see if you see a beat or her foot plantar flex or point down, and you just relax, Lonnie.
Yeah, sometimes I pull the foot up a little bit, I was going to say.
The biggest thing here, the person has to relax and think about something else. Have them look somewhere else. If they're looking down and watching you do it, it won't work. There we go. She's got a really good, strong beat there. She is not doing that consciously. It's all reflex. Is that true, Lonnie? Better say yes. And then there's another one, and this is called Clonise. And all you do here is I'm going to quickly pull the toes up, and then there's beats. If you watch her toes right here, she's not doing that consciously.
Yeah, she gets a beat there, doesn't she?
Actually, 2 of them.
Two beats.
Two beats. If you get more than 3 clear beats, that's a positive. So you don't have any problems, right, Lon? You're a healthy person and everything's going well.
As far as she knows.
Right. So again, if you're having a back problem, you have a pinched nerve, the doctor or the therapist may do these tests to find out if it's a problem in the neurological system, or it could be something like if you had a stroke is a really good time where they're going to do these to see if there's a problem in the brain or in the spinal cord itself. So you can practice these, and they can be kind of fun to do. And if you're a therapist or a professional in this, it might be a good review for you, or you may want to see something done a little more specifically. So once again, Bob, what do you have to say?
I have to say, Lonnie does a good job. I don't think I need to show up anymore.
Thanks, Lonnie.
All right, thanks.